Thank you very much and welcome to the Great Minds series at CES. I'm delighted to present to you a fantastic panel. Let me introduce myself very briefly. I'm Ketan Patel, the chair of Force for Good and part of the leadership team of the World Academy of Art and Science. Today's session is at the intersection of technology and healthcare, and is presented by the Human Security for All campaign, which has worked with the United Nations to bring the message of the idea of human security to be a message for everyone, not just for at the government level or the international level, but every individual. And healthcare is a critical part of that. Tomorrow we launch our report, Technology as a Force for Good, and a critical aspect of that report is, of course, healthcare, but also more broadly, the advancement of humanity through technology, which of course is the subject and the spirit of what we'll be discussing at CES and touching on the healthcare aspects on this panel. A brief introduction of the panelists, and I'll ask them to introduce themselves properly. So we have three fascinating individuals. First, we have Pedro Conceição, who is at the UNDP, so from the United Nations, and he'll introduce himself a bit more in a moment. We have Nan-Wei. Nan-Wei is a medtech entrepreneur and is managing a spin-off from MIT. And we have Dr. John Williams, who for 2 presidents in the US has looked at cancer and how we communicate it to the public. Each of them will introduce themselves briefly now. And would you just talk briefly also about what is the most important thing you feel about technology and healthcare? Pedro, would you mind kicking off?
Sure. Thank you, Ketan. It's a pleasure to be here. So the United Nations Development Program where I'm at is, in a sense, the development branch of the United Nations. It's about a $5 billion a year organization that works primarily in low and middle income countries. So the perspective that I'll bring is probably a bit different from some of the others that you'll be hearing throughout this conference. And we look at development in a specific way that considers that development, for development to take place, obviously the economy is important, income is important, but actually people's well-being, human security, human development is what should drive us in understanding whether we're making progress on development. So we have this specific angle on human development. And in that sense, health and what happens with health outcomes is a primary concern of whether countries are making progress when it comes to development. Now, the big gap, challenge from our perspective, is the fact that we have still many people that are being left behind from the opportunities of the 21st century, the 21st economy, the 21st technologies. I'll give you a number, and throughout the panel probably I'll give you a few more, but currently we have 1.1 billion people in the world, 1.1 billion people in the world living in multidimensional poverty. So it gives you a sense of the scale of the challenge that we confront globally to meet this aspiration of enabling people everywhere to live lives to their full potential.
Pedro, thank you. That sets the scene well for what technology has to do. Nan-Wei.
Hi, hello everyone. My name is Nan-Wei Gong, and I'm the founder and CEO of Figure 8. We are a medtech innovation that really brings technology access for every point of care, like the ability to understand musculoskeletal health, injury, and recovery. Imagine like an EKG or ECG type of device in rural areas where you can really tell to give you data just like what you have access in a biomechanics lab that is not traditionally accessible. What I can contribute to the topic we discussed today really is about health equity. The access of healthcare, the access of good diagnostic output, and also health outcome measurement that's traditionally just not accessible to many rural areas in most parts of the world.
Thank you, Nan-Wei. John.
Hi, I'm John Williams. I'm a breast cancer surgeon in Northern Virginia outside of Washington, D.C. And what I do in my day job is I'm a private practice cancer surgeon. What I also enjoy doing is communicating online and messaging good health messages that resonate and change people's behavior to get better health care wherever they are. I've had the privilege of getting involved in policy, and I've served the last 2 administrations as chairman of the President's Cancer Panel, which advises the President and the White House on opportunities to improve our national cancer program. Transparency builds trust, and healthcare is complicated. Technology plays an incredible role in that, but ultimately it is a human act, a doctor-patient relationship. And I challenge all of you that are in the technology industry, whether it's healthcare or another variation of technology, to prioritize in what you do to touch those that are not touched, especially those in parts of our world that are never touched. Those are the biggest wins, and you can roll that priority in what you do for your business and your current mission.
Thank you, John. Thank you very much. As an audience also, I'd like to tell you that one of the missions of Force for Good is to see if we can help close this gap with technologies. And with the World Academy of Art and Science too, we're looking at that mission for solutions. And so I'm fascinated, Pedro, for you to set the scene. You said 1.1 billion people out of just over 8 are in structural poverty. And we heard earlier on the video that launched this that 4 billion don't really get any meaningful health care. Will you explain the dimensions of that? And what do you think is the expectation of technology to see if we can close this gap?
Sure, Ketan. And I'll build on something that John has said. One of the things that we have learned is that technology on its own cannot do much. It's about the way in which technology interacts with people, the way in which technology is embedded in society. And so I'll just give you 2 elements about the challenge of making technology work in these settings, which include also fragile and conflict-affected settings, which at the moment are actually increasing. We have the largest number of forcibly displaced people in the world at the moment as a result of violent conflict in many parts of the world, as we see in the news every day. So the 2 elements that I think to bear in mind is that for this interaction between technology and people to work, there are at least 2 things that are needed. One is a number of complementary assets. So in many parts of the settings, we don't have, for instance, access to electricity, something that we take for granted in parts of the world where we are at the moment. 700 million people around the world don't have electricity access. And many, even when they have electricity access, this electricity delivery is spotty or they cannot afford it, so they don't use it. So we have 1.1 billion people in poverty, 1.1 billion people without electricity access. 2/3 or 1/3, of the global population does not have internet access. So when we think about solutions like telemedicine, for instance, and the potential that they have, we have to think, and this is a challenge for all of you that are many of you technology experts or work in technology companies, how do we think of the technology solutions for this kind of settings where you don't have electricity and you cannot assume that you have electricity access? The solution sometimes is in the technology itself. Even though there is not internet access, there's a lot of access, for instance, to mobile phones. 95% of the global population has access to a mobile phone. So there are opportunities also within the technology realm, but I think we need to understand what are the constraints. And the second element that I think is very important to bear in mind is the cultural setting in which we are deploying these technologies. I'll give you an example. I was involved in a different role in UNDP in the response to the Ebola outbreak in West Africa. Do you remember the Ebola outbreak in West Africa? Many of you probably don't remember. So the transmission of the virus is very well understood scientifically, and the way to stop the transmission of virus is straightforward. And yet, we were not able to stop the transmission of the virus. Why? Because the way in which we were conveying information to the local populations was not being given by the people that in those settings respected, by people of authority. So it was being given by people like me, or by doctors, or by NGOs. And we had to find a way of understanding who are the people in positions of authority in those settings that would be able to lead to the behavioral change that would lead to the transmission of the virus. So understanding the human element and the way in which it interacts with the technology, which will be different in different parts of the world, is crucial to ensure that technology can be effective in narrowing these gaps.
John, I'm going to ask you to jump in now before we come to Nan-Wei, because this is a field that you have spent some time mastering, this communication of complex things for people so they act and they understand.
I think we need to think about, especially with the developing world, is there are resources there, but they're probably underutilized. Building that platform and their resources on the ground is a larger economic mission. But when you have so many people that don't go to the doctor, don't get prenatal health care, therefore the life expectancy for infants and adults is so much lower than it should be because of behaviors. So we can parse this out like we had with COVID. Very complicated. We were learning about, very similar to Ebola. And we mitigated things, but we have televisions, we hear all that messaging. We're inundated in the United States and in other countries with information. But whether people act on it is related to a couple of aspects. Number one, do we trust the messenger? And we've lost a lot of trust in our healthcare system because we're not given choices and we're not given the background and the advantages and disadvantages to choices. So going back, our job is to give good messaging, good choices, because there's a fundamental freedom that everyone has, is the ability to make a choice to do something rather than be told to do it. And we fail when we tell people, and the success rate is less than when we convince people. And that's what messaging is. So warmth, transparency, I think, is a key element in achieving success. And technology is so critical for getting a message out, a good message out, and having it uptake wherever that is.
Thank you, John. Nan-Wei, I want you to pick that up in terms of what are the breakthroughs in technology that you think can reach people? And I know where you're based physically, and your outreach into other parts of this country. You talk about that too for us.
Absolutely. I think this, in terms of health equity and technology access and how we can change the world, especially in healthcare, this is the best conference to talk about. We're at CES, innovators in consumer electronics, where it's built in a really, really fast development cycle. Traditionally in medical technology or just in healthcare, you think it's really slow moving. You think 5 years, 10 years is an acceptable way to think about things. Traditionally, healthcare don't talk about virality. We don't talk about scalability because you have all the latest technology in medical centers. But CES and what the community represents really is how do we build something for everybody? How do I put a smartwatch on everyone's wrist? And that's a foundation that allows us to build something that's accessible at an affordable price point, as well as communicating in languages that people understand. So I think the breakthrough not only is in the concept of digital health, where we can communicate information about diseases and have second opinion, have platforms that gives everyone information, including what AI can tell us about our health and the diagnosis in a meaningful way, digestible way. I also think the development of wearable technology, sensors, and also the computing power really enables us to push out just devices in a way that's accessible to rural areas or everywhere in the world. But the mentality in the community is CES, because that's how we design the consumer product. So I'm happy to share more about from the technology perspective. That's really the breakthrough for me.
If you, Pedro, for a second, think of what Nan-Wei just said and the technologies, what can you imagine could be valuable if it was serving the poor? Is there some translation you see?
Definitely, and I think AI specifically has a huge potential. And the way I see it, and I'm here also to learn more, but the way I see it, the applications of AI in health have perhaps been focused on efficiencies, trying to achieve efficiencies or cost reductions. For instance, helping doctors write their reports to lower the burden of that task so that they can have more time interacting with patients, or lowering the costs of healthcare in places like the United States where the costs are very high. But with the generative AI, I think there's a potential to innovate also on the product side, on what we're just discussing. How do you communicate and transmit information to people? Particularly in the low income settings that I was describing earlier. We are trying, and one of the interesting findings that is emerging is once again that there needs to be a complementarity between people and the technology. So we had an experiment where we deployed a language model, not a large language model, a relatively small language model that can run on phones in a low-income setting, to enable people to have access to a bot with whom people could interact to get health information. And the uptake of this device was extremely low. People didn't really pick it up, even though it was free. So what made a difference was to have someone in the village be the intermediary between the language model and the people that were interested in asking questions. So there is a need to have, at least in this setting, some intermediary between the technology, AI, and the users. And I think there's good news in this, in the sense that another concern with AI is that it's going to replace occupations, even eliminate jobs. But here we have an example where actually the deployment of AI actually increased the demand for labor, for these people that would need to play this role in the villages as intermediaries between the technology and the users. So it's one example, it's a small scale, but I think there's a huge potential in the deployment of generative AI in the way I described at scale to narrow the gaps that I've described.
John, would you pick that up in terms of AI, telemedicine, the virtual delivery, the role of the expert? How is that changing?
Well, we all learned a lot about AI last night at the CEO of Navida's talk. I certainly learned more than I could understand, I think. AI plays an important role. Now remember, we're trying to touch people, and we're really talking about untouched people, and I think that's really the focus of one of the opportunities and the purpose of this talk. People live in different communities and different cultures. They have different belief systems. The United States is very diverse. Boy, move around the world, it's incredibly diverse, and in some ways isolated. So you have to have a message, let's say to get a mammogram. Let's just assume that's available everywhere. But you have to translate that into hundreds of languages if you're going to get a message across, and a good message that resonates. But one that resonates in your culture. It is very difficult, and it takes time and effort and people on the ground and money and resources that these countries typically do not have. So that's where AI really can play a role in not only translating, it's more than changing the language, but also to weave in some of the cultural differences of messaging, of touching people, to get services that not only improve the quality of their health, but also extends their lives. The one thing about AI, my son, he's 18, and he says, "Dad, ChatGPT lies to me all the time." And in medicine and in healthcare, it's so important for us to be not only believe but give good information. We're not perfect. The information I give to individuals that I see daily is not perfect. But we can't replace that message, which is hopefully backed up by good science and good health policy.
Thank you, Jean. Nan-Wei, would you pick that up in terms of AI and mobility and tech, which is an important field for you?
Yeah, for me, healthcare and AI, there's a lot of possibility that is outside just the language model, because now with advancements of a lot of different technology, point of care screening, point of care diagnosis, telemedicine, that is not just translating the message to another language, but we collect data about different demographics a lot easier, a lot faster, in a scale that's never been seen before. AI help us understand context. AI help us understand the demographic biases. If we are programmed properly, AI help us process all the information. Normally, like a doctor has to, read your medical history for the past 10 years. If done properly, we will be able to really come up with personalized conclusion, have personalized data input, and compare with the database of the world. So it's about data access. It's about having equity in terms of the access in technology that is not just for those very elite cities and hospitals. And it's about how do we really leverage all the infrastructure that is not built for healthcare, but for healthcare. And I think it's a beautiful thing that we see all the talks of the companies and the technology that is built for multiple applications that for our daily lives nowadays available for healthcare. And love to brainstorm on how we can really leverage that infrastructure so it can be scaled up globally as opposed to just in very specific healthcare areas in the United States.
Nan-Wei, would you make it a bit more specific in terms of your product and what it does and how it came out of the laboratory into the field, and where is the interest for that product?
Yeah,
what is important about this product?
Yeah, absolutely. So my company, Figure 8, we leverage decades of research in sports medicine and biomechanics that normally is only available in major universities and in really fancy hospitals or the NFL, for example. And we created something that is portable, that I insist you have to be able to ship in a FedEx box. You can ship it and then train someone within an hour so that you have access to something that, that can tell you the severity and recovery of your musculoskeletal injury. Now, this was not available before. It replaces a lot of really, subjective doctor analysis, which varies across the board. So this is just an example of technology that allows us to have it's a distributed sensor network, if you think about it. It's a distributed health network to collect information so that it's available for everyone. Now, the interest for the product is actually we do so well in rural areas in America. We do a lot of, blue-collar workers. We help them gain access and insight of their health. So it's not, it's basically the accessibility is key. Now with that accessibility, they can connect with telemedicine all over the world. And that concept is not unique to my company, but it's really like the revolution of how wearable computers, how better accessible diagnostic tools allows us to elevate the concept of telemedicine. And I think it also translates to all the UN missions of how to have better well-beings for humans. And that's just, it's not unique to any company, but that's just like us sharing the technology advancement to the world.
Very good, very good. Pedro, pick that up, please, because 4 billion people don't have great healthcare in the world. If we see them as customers, not as people with a need who can't pay, but as customers, we can't build enough hospitals, we can't train enough doctors in time to serve them. especially given the UN Sustainable Development Goals are 5-6 years away now to fruition. Technology is the only way you could actually access those people and serve them well. What is the architecture of that in terms of technology playing its role in a world where you can't build that many hospitals or that many doctors?
I agree with the premise of the question, Ketan, that technology has to be part of the solution. But I go back to the theme that I've been emphasizing and we've been emphasizing on the panel, which is the importance of understanding how the technology interacts with people, right? And how it's embedded in the broader society.
You're not going to tell me it's these GUI people that are the problem, right?
No, on the contrary. But
okay.
I'm looking at you all to give us the solutions. But let me lay out the opportunities and also some of the challenges, staying within the realm of AI for a moment. So one of the things that we also observe is that when you have these devices with, again, small language models, remember, many of these people are not connected to the internet, right? So it's not like you can do a Google search when you have a question. And sometimes, for cultural reasons, you hesitate to ask some questions related to your health to a healthcare provider. So we have evidence that when people have these language models in these small devices, they ask questions about their health that they wouldn't ask another human to the model. So here is the opportunity. Where is the risk? As John said, these models often just put out garbage, as we know. It's called hallucination. So it's risky, and it's particularly risky when we think of issues related to mental health, which is, again, an area in which there's huge potential to rely on these chatbots to have interactions that potentially improve people's mental health, but huge risks as well, in part because of hallucinations. So I guess what I'm laying out here is not an answer perhaps to your question, but putting a bit more precision in terms of the challenges that we need to address by looking both at the technology and understanding at the way in which it interacts with people, addressing the technical problems of hallucination. Some papers argue that these large language models are inherently hallucinating, that we can never fully get rid of hallucination. So what do we do in that context? Do we always need an intermediary, a human intermediary, when it comes to healthcare? What are the protocols? What are the standards that we need to put in place to address this challenge? What can technology do? So again, not an answer, but perhaps laying out questions to all of you that are the tech experts to help us to harness the potential of technology to solve these problems.
John, we need you to reflect on that as a doctor too, and this trust question has been raised. Tell us.
I sort of see this, and most of the people in this room are business people. So let me paint a model, a business model, to touch those that we do not touch well or that we don't touch at all on a global scale. So, business model. You have a product, whether it's a product that you make, or the product can be good advice to wear a mask in an Ebola environment. We have a that healthcare message product, the goal is to touch others to change their lives. But how do you get there? So the product is medicine and doctors and technology and what we know works. But just like you're at this conference and we got 4,500 exhibitors of companies, you have to market this product or message with multiple touches along the way, just like if you're going to sell a product or a robot to a company. Multiple interactions with individuals of different languages, of different cultures, with varying technology to get information. And that requires trust, messaging, risk and benefits, and employing people to make their own choice, to have individual freedom. It's an inalienable right. So technology, that's where the vast aspect of what you all do to help people in the world. get that message out, get that product there, but get it in with AI and word language models, culturally inexpensive ways to communicate in a cultural way to so many different communities. And then you got to make the sale. You got to get the company to buy your robot, buy our message, by going to the doctor. And that's the culmination, not only of the product, but the marketing for good. And the sale is changing behavior, affecting good, helping people, and extending lives. And that's what I would like for you to think about all of what we're talking. It's the same thing you do every day. And I challenge you to try to use your expertise, a unique expertise that does not translate well to healthcare and doctors, to achieve that end goal.
Nan-Wei, I'm going to ask you to pick up from that very difficult point now, which is we're touching on the edges of technology changing the way we serve completely. How is that accelerated by the technologies that you're seeing and coming across? Which technologies do you feel make the biggest difference to patients?
I think for what I see that's really interesting recently is there's a fine line between a healthcare indication in terms of a medical decision or medical suggestions versus wellness decision and wellness suggestions. On this panel with the discussion on having access to healthcare, I think another thing for all of us to think about is bringing technology and the information to everyone in the wellness context, because there are a lot of regulatory barriers to bring something into a hospital. But the two types of test beds, one is work with the UN or like USAID. I was talking about the potential of helping different developing countries on access technology and data to help them improve their health outcomes or just in overall health. From different information, you provide information, education, or just provide basic wellness indicator that can help people to have an understanding of their health. So from the technology perspective, how do we think about this blurry line between wellness and healthcare, and then finding the right entry point to have the biggest impact is where I see that's interesting in the conference. Right? We could start from a glucose monitor that is for wellness, and then it gives you like a diagnostic output. But where do we start to have the highest impact, and what messages, in which market do we start to reach more people? That it's up for debate, but I think it's just so interesting to think about a healthcare test bed that is outside of the United States, that can reach a lot of people and then come in as a medical device or in a bit higher regulated environments. So that's how I see the whole conference, and then how we can think about bringing technology into better health outcomes or into healthcare as different pathways and trajectories that I don't think is taught a lot enough.
Interesting. Because Pedro, I would guess if when you walk the halls later and you see the technologies, last year one of the biggest ranges of technology innovations we saw were to do with healthcare, so health and technology. I wonder if you were guided by the right person and you walk through the halls, you would probably find a dozen pieces of technology which could be adapted, that could serve people on basic healthcare and basic information they need all around the world. And what we found as we've done our work and our studying is there is a purchasing power. We looked across all sectors, and we think that purchasing power in just the global south amongst the poor is something like $15 trillion. Healthcare is one part of that. So the question is, what do you serve to a market that is potentially that scale and size? And how would you leverage CES, who has a special forum just for tech and healthcare, to start to address the need? And what I'm going to come on to, just to put you both on notice, is there's also a need, of course, in wealthier countries to still find the gaps that aren't served, but also drive performance, not just well-being and wellness, but drive human performance to another level. and technology can help us do that too. And we have the spectrum here of need.
So, Ketan, my suggestion to all of us interested in engaging with this challenge is to have a framing that is not premised on the idea that a certain technology exists up here that works very well, say in the US, even in the private sectors in the US, and let's see how we diffuse it into these settings, like this sort of top-down. I think that is unlikely to work and unlikely to take advantage of this huge purchasing power. I think what I would encourage all of us is to sort of level the playing field and find ways of interacting and understanding these communities. What do they need? What are they lacking? And as you do that, you'll also benefit because you also get some information. You also get some data to improve, if you're thinking about, again, a AI training model, to improve the training of your model, to make it more culturally diverse, for instance. Not only language, but culturally diverse. So I think that would be my suggestion, perhaps, is that we have a way of finding a way of engaging and communicating on sort of a level playing field with these communities, understanding what they need, and that is the way to seize on these opportunities that you described, Ketan, in my view.
Okay, we're going to rely on you to communicate with us to help us advance that agenda. Just quickly, both of you, as we come to the last few minutes. Nan-Wei, do you want to pick up performance and technology? So beyond just medical need, how can technology help drive human performance?
I think what's really important is to understand how to measure outcome in healthcare. We have a lot of areas in medicine where there isn't a really clear indication of health outcomes. So I think technology really allows us on having, like, setting up those metrics so we know how to quantify our performance or health, just like a step counter, right? So that really helps you get an awareness of, okay, did I walk 10,000 steps a day? It may sound simple, but those incremental success is how we really, bring the overall health of everybody in a meaningful way. So that's how I see technology can really help us drive health outcome.
John, do you want to pick that up in terms of the gaps that we have, even in rich countries, and driving the performance?
The act of helping people, and I still say medicine just because I'm a physician, is exactly the same, and the importance is the same in the United States or in the Sudan. It is complicated, it is important, it's personal. You're also asking time from people that are busy, just like we all are. Technology allows us to build a bridge from where we have vast amounts of technology to those, and share that bridge, and that bridge becomes a road to these places that need that bridge to quickly deliver healthcare that we've learned how to do it fast, efficiently, at low cost, but get it there quickly. So technology in your job, as I see it, regardless of the message, but also the products, is one where you're building that bridge. But sometimes it's a bridge to nowhere. That's a famous United States statement where we built an expensive bridge to an island in Alaska, I think it was, but there was no one to travel on it. There was no support system, and no one heard the message because the bridge went to an island that no one wanted to go to. It was very expensive. So your job is to build that bridge, that technology bridge, so then everything flows through it easily. Information technology, electronic information, products. And do it with kindness and thoughtfulness, and tailor your message and your products in that way. And people listen to you, they change their behavior, they thrive, and they'll live longer.
That's a great place to stop, because we've reached the end of this panel. And I'll just thank this panel for sharing their thoughts. And we've gone from the world need of 4 billion people and 1 billion in deep poverty to the Americas and some of the bridges to nowhere, but the solutions that exist in this country that could help the world, and the need to talk more to find those answers to fill that gap. Thank you very much for sharing. Thank you.